Adapting to CPAP therapy takes time and patience and willingness by the individual. Everyone adapts at different rates. Some just a couple of nights with CPAP and they feel a world of difference. For others, it may take several weeks. The objective is to wear your CPAP every night, even for just a few hours to start. Working your way up to be able to wear it all night with no interruptions may take time, and that's okay. The wireless modem on your device will provide us with a download of how you're performing with your CPAP. It can help us identify problem areas that we'll want to discuss with you. All you need to do is make sure that you keep your CPAP plugged into electricity when you aren't using it so that we can download it and keep track of your progress. Our staff will contact you by phone if we've identified any areas that need to be addressed, such as how many hours you're using it, any mask leak that you may have or mask fit issues, if there's an increase in the amount of apneas you're having at night, or new occurrences of central apneas. Our goal is to ensure that you are successful with your CPAP machine and sleep therapy so that your symptoms decrease and eventually disappear. Every insurance provider has requirements for following up with your physician about your progress on CPAP.
This isn't going to be something that you get used to immediately. It takes a little time. We usually tell people about 3 weeks of wearing it every night. Your insurance has some guidelines that we need to go through. In order to be considered compliant, they expect for you to wear this 4 hours a night, minimum. For your benefit, you're going to want to wear it longer. The health benefits, you really need to wear it while you're sleeping, at least 5 hours a night. When you've been wearing it 4 to 5 hours a night for 5 days in a row, your family members should notice some subtle changes. Maybe you're not falling asleep during movies, maybe you're not as irritable as you were, you're getting up, you have more energy. Within 3 weeks, we expect you to see some changes in the way that you feel. Insurance considers that compliance at 4 hours, and they need you to be wearing it 4 hours a night for 5 out of 7 days, 30 days in a row. Okay. So they give us 90 days to get there. There's a trial period. Okay. When you get up in the morning, it's probably the best idea to empty your water chamber. So you don't want a warm, moist environment for bacteria to breed. So just open up your water chamber, empty whatever water you'll have left, and just leave it open in the daytime so that it can kind of dry out. When you're going to replace that at night and clean this out once a week. You're going to wash it with soap and water. You're going to flick the filter out that we talked about. That filter, you have to kind of open that filter door from the back. You're going to flick this out once a week. So everything's once a week except for emptying the water daily. You're going to wash the mask once a week. You're going to want to clean this good with soap and water once a week, more frequently if you have a cold. And this tubing, you're going to take the tubing off, and you're going to put this in a sink full of sudsy water, let it sit a bit, rinse it good, and hang it over the shower head to dry, okay? So we're cleaning the water chamber, the mask, the filter, and the tubing once a week, okay? We're concerned with bacteria, so this is all stuff that you are breathing in. We want to keep everything as clean as we can. We replace the water chamber, we replace the tubing, and we replace the mask and the filter. These are all considered disposables. You want to replace them on a schedule so that you don't have to worry about bacteria building up.
After you've started your CPAP therapy, Memorial Home Services will be in contact with you by mail or by phone if we see any trouble with your compliance, any therapy issues, or mask issues. If you do not hear from us, that's good news. Our billing department will correspond with you as well should any questions arise about rental fees or payments. Lastly, and most important, CPAP therapy can sometimes be difficult to get used to for some people. The key is not to get frustrated when you're having trouble. Almost everyone encounters trouble adapting to CPAP therapy at night. Do not let 1 or 2 or even 3 nights of struggling with your CPAP dictate how you will do several months from now. It will take some time to adjust. If you're met with episodes of waking up and struggling to fall back asleep while wearing your CPAP mask, just go ahead and take it off and try it again the next night. Sometimes people inadvertently take off their mask throughout the night and don't realize it until the next morning. That's okay. You'll eventually get used to it and it will help improve your overall health, just as it has for countless other CPAP patients that we've worked with in the past. Good luck, and remember, we're here to help you. Thank you for choosing Memorial Home Services today. We look forward to working with you in the future for any of your medical equipment needs.